So today is day 93 of this unprovoked Russian war on Ukrainian civilians. As of today, more than 14 million people have fled their homes in Ukraine. 6 million of them have left the children. And many children with serious illness had to flee as well. Those of you who have been here in these conferences over the last few years met many of our Ukrainian friends and colleagues. There was a very well-established pediatric palliative care program in Ukraine, going out of Kharkiv, going out of Kiev, going out of Lviv, and really covering the whole country. Many of those have been, we worked with them. These were friends, these were people we learned from, these were colleagues we taught with, these were colleagues we trained. And some of you here in the audience, many of our colleagues were not able to come. And more evidence is coming out to light, proving Russian atrocities and war crimes. Shelling of more than 100 hospitals, shelling of schools and whole cities, such as Mariupol, sexual violence to children and women, and willful killing of civilians. More than 200 children were killed to this day. So this session is basically about children's palliative care in a humanitarian crisis. As you just heard from Julie, this is, of course, something which is happening all over the world. But this session, we're going to concentrate on the Ukraine. So we have actually 45 minutes in part one, and we have 45 minutes in part two. In part one, Julia and I will basically ask a lot of people to the microphone, and they have sometimes 1 minute, sometimes 5 minutes, sometimes 10 minutes. It's short to really just give us some background information. And then in the second part, we are going to hand over to Christina and Pukalski and Justin Baker. In the second part, there will be a listening session, listening to our friends from Ukraine. And as Joan is going to tell us in a second, right, this is not about talking. This is about listening and, more importantly, what are we actually going to do? Because we have done enough talking. What are we going to do? So with that, it's my great pleasure to ask Christoph Ostergater, who is the current president of the European Association of Palliative Care, to start us off.
Thank you very much, Stefan, Julia. A few weeks ago, the EAPC headquarters received a cry for help for a 6-year-old boy and his mother. I quote from the email: "I'm looking for a hospice which could accept a 6-year-old boy in coma on life support from Kiev. He has a long list of diseases and requires constant care. Currently, the child is in a Kiev hospital in a basement because the hospital was shelled recently. His mother is looking for a place in Europe where her son and she could find a safe refugee. In case you cannot suggest an accommodation possibility for him, I would be grateful for any other ideas, contacts, or recommendations." End of quote. Even being on life-prolonging medical treatment, this boy had a bundle of palliative care needs. This is only one narrative, one person, one family that shows that this war is waged with incredible brutality and endless help is needed, not only, but equally for people in palliative care. I assume we hear more of that this afternoon. As you have heard, I'm the current president of the EAPC. The EAPC is a forum for those who work in palliative care in Europe, and we lobby and advocate for palliative care in Europe and beyond. This meeting, as Stefan has said, takes place in difficult times for Europe and the world. After years in peace in Europe, we now find ourselves in the midst of a destructive, inhumane war that is bringing unbelievable suffering to many people in Ukraine, but also in many other places in the world. Just say something about hunger, for example. Of course, all this has an impact on the patients who need palliative care and those who provide this care as professionals and voluntary workers on the ground. We have heard, as the story I've told you, many cries for help from palliative care professionals in the Ukraine in the recent months. The good thing is, and that is really moving myself, The International Peer Group on Palliative Care is responding. This meeting here is evidence for that. I am deeply impressed by the overwhelming willingness to help that we have received from our members and other palliative care associations and the joint action of many groups. Some of them are here: PalChase, ICPCN, the Maruzza Foundation, IHPC, WHPCA, and many others. Sometimes I feel desperate in the face of all that suffering. At the same time, we should not let ourselves be paralyzed, but stand in solidarity with our brave friends. Some of them are here today in the Ukraine. Last week, on the day before the EAPC World Research Congress started, we had an impressive webinar on palliative care in times of humanitarian crisis, an issue that EAPC has been working on for many years, including through a task force on refugee and migrants that Joanne is heading. We counted more than 120 participants from all over the world, and I was deeply moved by the very personal narratives from our friends in the Ukraine. We started a series of blogs in palliative care in the Ukraine. And what stays clear in all this is that palliative care is humanity to infinity. Palliative care is a human right. When the Russians withdrew from Kiev, it was decided that the boy could stay in his familiar surrounding. The mother was, even though that finally no transport was necessary, grateful for the lift support and the peer solidarity. In this sense, I wish all a fruitful meeting. Once again, I want to give my deep thanks to all who do the groundwork under extreme difficult circumstances. We hear all about this afternoon, and thanks for the Maruzza Foundation for making this session possible. Thank you.
Thank you very much, Christoph. And I'd like now to invite Joan Marston from PalChase to come up and to say a few words of welcome from PalChase, and then to talk to us about paediatric palliative care in humanitarian crisis. And Joan, thank you very much for bringing us all together in this session. So over to you.
Okay. Thank you so much, and thank you to Sylvia for the support of the Maruzza Foundation. I wrote to them well after all the workshops and all the abstracts had to be in, and their immediate response was, of course, we can have this session. And Christoph, thank you so much for the commitment from EAPC, because this is your area and it's so important that you are leading in the response. Now, I had a PowerPoint, but I'm not going to show it. I'm sure you're pleased about that. You've seen lots of PowerPoints today. There are wonderful things happening in the field of pediatric palliative care to help our colleagues in Ukraine. So why is it that with so many humanitarian crises around the world, we are responding like this to Ukraine? Well, I'm involved in the executive of PalChase. I'm responsible for advocacy. And we have been looking at these humanitarian crises around the world and doing things. But the difference with Ukraine is this is the one country, there is an acute humanitarian crisis. The other countries where we see these crises don't have pediatric palliative care, or if they do, they have one or two individuals trying to integrate it. And for those countries, we have an education program for people working in the humanitarian health response, because we recognize that we are a small community as a pediatric palliative care community. And we might feel that actually we don't have that much to offer. But if we put together all that we have, we're an extremely rich resource of knowledge and skills and resources. So in Ukraine, we have these colleagues. We had colleagues who registered for this conference and who had to cancel their registration. Just this morning, I had messages from two of them sending their love to all of you, saying they wish they could be here with you, but they feel the love and they feel the prayers. So whereas in other countries we don't have a hook to build on, in Ukraine we have this wonderful network of pediatric palliative care programs. We have real expertise in Ukraine, people that we actually need to support and in a way protect, because we need these people to, again, lead the charge in providing pediatric palliative care in Ukraine. So these are not unknown. These are our friends. These are our colleagues. And I think together we can help. You're going to be hearing this morning about some fabulous initiatives that are there. I've just had some information from Alex Smith, our neonatal expert, on the work that the neonatal group in the UK are doing as well to support. She said 80,000 babies have been born in Ukraine since the war started. And we know that when there is a humanitarian crisis, there are many more children, babies who are born prematurely, and mortality increases. So we know that there's a need in Ukraine. We know that we have resources out of here that can support. It might feel, as I said, that we feel we each have so little to give. But if we put all those little bits together, then it can actually be a fairly big package, and if we work collaboratively. And so, while I know, just looking at Ukraine, sometimes reading this morning about the extra attacks now on Kharkiv and on the east, my heart absolutely sank. But it's not enough to feel. We actually have to do. And I think this is an amazing opportunity for us as a global pediatric palliative care community to show what we can do. To say if we believe that pediatric palliative care is a child's right, it is a human right, it's accepted as a human right, and it's part of universal health coverage, not just to say we're going to give it where we're comfortable, where it's fairly easy to do it, that if we really believe that every child has the right to palliative care, that we need to reach those children in the DRC, in Tigray, in Yemen, in Afghanistan. And we have to do it in different ways according to the circumstances. Here we have a wonderful opportunity to work across borders. And the other thing with Ukraine is the borders are open, apart, of course, from the borders to Russia and Belarus. But the other borders are open, which doesn't usually happen in this kind of humanitarian crisis. We have an amazing network of communication through social media, which we don't see. We've had a lot of support to Ukraine to keep the communication channels open. So the challenge is there. I think that we can rise to the challenge, and I really look forward to this session today, to hearing and to listening. So thank you, all of you, for participating and being here today, because that shows that you care. Thank you.
Thank you, Joanne. And we have now a handful of amazing speakers, and I will ask Marta Salek to come up and in the next few minutes to tell us a little bit more about Safer Ukraine and your global initiative.
Thank you, Stefan.
Take the microphone.
Oh, thank you. Yes. Thank you so much. My name is Marta Salek. I'm a palliative oncologist from St. Jude in the United States. I'm Polish-Canadian, so if there are any Canadians or individuals from Poland, please come and say hi. And I'm here to talk about Safer Ukraine, which stands for Supporting Action for Emergency Response in Ukraine. So as you all know, on February 24th, Russian military forces began a coordinated invasion in Ukraine. And on the 26th, the Pediatric Society of Polish Oncology and Hematology announced national support for Ukrainian patients, and the Polish Ministry of Health declared plans to finance all cost of treatment for children who are coming from Ukraine. And so there was a lot of emotion, a lot of feelings from our Ukrainian teams, both clinicians and foundation supporters. And we talked with our Ukrainian colleagues, our colleagues in Poland, and our international collaborators, and we decided that we could do something to help. And so from this, we established Safer Ukraine, whose mission is to aid Ukrainian children diagnosed with cancer and blood disorders to reach physical safety and continue high-quality medical care. And so briefly, what we established our helpline through the Tabletoczki Foundation, where families could contact the foundation and request assistance with evacuation. We would obtain medical records, which were often photographs of documents that were translated by individuals, volunteers from all over the world. And then they were either taken directly to Poland or through our center in Lviv, the Western Ukrainian Specialized Children's Medical Center, where they were triaged further. And Poland has been so welcoming in accepting individuals from Ukraine, in both those who are sick and not sick, and they were a natural supporter for helping the Ukrainian children in the first immediate time point. But then we realized that there was a point of saturation and that the Polish medical system could only safely accept so many patients so that they wouldn't compromise the care of Polish children or the Ukrainian children that needed support. And so we developed a triage center called the Unicorn Clinic in southern Poland, which accepted stable patients, gave them lodging, food, and support while we waited to send them to different European countries and to North America, whereas unstable children were always taken immediately to a Polish center. And so just briefly talking about the progress to date, we have arranged several convoys through a humanitarian corridor that was established from Lviv to Poland, but also helped support the humanitarian corridors that were developed in other parts of the country. We've taken over 280 children to Poland and even more all over the country, and as representatives of Europe and North America, you should be very proud, and I'm sure many of you have helped support these children already. And just to show some photos, we love seeing photos of the families evacuating, but specifically I want to thank our Italian colleagues who really were the first to step up after Poland to accept and transport these patients out, and in particular to the Solitaire Foundation and to Dr. Marco Zecca, who are amazing, and many other Italian clinicians who've been of great help. And so specifically, in terms of pediatric palliative care for in the context of childhood cancer, we do have some data. We have amazing champions, like you've heard, in pediatric palliative care in Ukraine. And we wanted to really understand the status of pediatric palliative care for children with cancer. And so my colleagues at St. Jude conducted a study called ADAPT in 2019, which is available, and I'm happy to share to anyone who's interested, that looked at physician access, knowledge, and perceptions to palliative care with children with cancer as outlined by the WHO. And so just to note that at that time, 71% of physicians reported no access to palliative care consultation. About 70% indicated that palliative care consultation was not available, but there was really an interest in learning about pediatric palliative care, with over 94% wanting more education. And so in terms of the opportunities and identified palliative care needs, we really need to listen and to respond to the needs that are voiced by Ukrainian patients, families, clinicians, and foundation partners. And so some of the needs that have been identified, including support for palliative care needs of Ukrainian children in Ukraine and abroad, the logistics of helping arrange the proper care, whether in Ukraine or in Europe, for these children, particularly at end of life, understanding the capacity, how can we do medication procurement, get different equipment delivered, or help find personnel to support these teams who are in Ukraine. And then also education. Can we help arrange clinical rotations for these individuals in Europe or in North America? Can we help provide educational training? And so I also think that we, just like we are here today at Maruca, show a commitment to supporting the strengthening of pediatric palliative care delivery in Ukraine now and after the war. And thank you so much for this opportunity to talk about our work, and I appreciate it very much.
Thank you very much, Marta, and it's really good to hear of the work that Safe Ukraine are doing, and I've been kind of following on social media as children have been moved out and provided with new places of care. So thank you for all the work that you and your team are doing. So we're now going to hear about experiences of providing pediatric palliative care in West Ukraine, and I'd like to invite our speaker to come up to the podium, and this is a presentation from Vita Voloshuk and Natalia Levko. So welcome, and we look forward to hearing from you.
Thank you. And
Can we have the presentation?
They don't have the slides?
Could you just go up and help them? Do you want to just introduce yourself whilst you wait?
Do you want to introduce yourself?
Okay. I'm Vita. I'm pediatrician. I work in 2 departments at our hospital. Of course, this is the Department of Mobile Hospice for Children at the emergency department. Also now I'm learning to getting specialized from gastroenterology and hepatology. And my presentation today was divided into 2 parts: the work of our department before the war and after the war. Oh, yes, this is my presentation. And I'm honored to be with you today at the 5th Maruza International Congress on Pediatric Palliative Care. And on the slide, we can see our hospital exterior. The next slide. Our palliative care team consists of 2 anesthesiologists, 3 pediatricians, 3 nurses, a psychologist, receptionist, and a driver. The name of our department is Mobile Hospice for Children. It's clear that the work of our department concentrated at the patient's home. Our patients live in their home with their family. When we arrive to our patients, we talk with our parents, our team talk with the parents about health of their children, ask about compliance, and after that start to work with patients. Specialists examining children, if it's necessary, he or she can replace tracheostomy tube or nasogastric tube, adjust therapy, or adjust parameter of mechanical ventilations, and monitor nutrition. To provide for our patient with a maximum comfortable condition, our department involved charity organizations and volunteers. Thanks for them, our patients have necessary medical equipment and consumables. Also, department provides it partly. Anyway, when our patients have a poor health status, we recommend transferring them to our center, where the patients can be hospitalized in a different department. Then we can use more aggressive therapy and more way examining them. And also, this patient can have a consultation with different specialists. Subsequently, all multidisciplinary teams are involved with our patient, and the main aim is to prevent and reduce suffering. And also, doctors and nurses work a lot for training our patient, for training our parents to take care of their children at home. And also, on this slide, we can see 4 groups of our patients who take care in our department. All of them are different. They have different diagnoses: hereditary, genetic, oncology, or metabolic disease. They have every family has its own history. Moreover, every family have individual approaches, but all of them unite one aim is to improve of quality of life their palliative children and reduce suffering. The idea to create hospice for children in our hospital appeared a long time ago. Specialists from our hospital had been caring for palliative children as volunteers at home for 6 years before hospice was created. And all such patients were treated at the different department of our hospital. When their condition improved, they were discharged, but they need continued medical care. Eventually, in January 2017, due to the activity and with help of the society and partnership cooperation, my colleagues create our hospice. Today, we have 90 palliative children in our hospice. 25 patients are breathing through a tracheostomy tube, 10 patients are mechanically ventilated, and 24 patients are fed via gastrostomy tube or nasogastric tube. After the war, everything changed in our country. It's important to say, during the war, Lviv is safer than another Ukrainian cities, but often air alarms indicated that every person needs to go to the shelter, to run to the shelter through air alarms, and because it's for their security immediately. Palliative patients need special care. It's very hard to live with this patient and very hard to run with this patient to the shelter through air alarms and or live with this patient for a long time through explosion around them. Also, it's impossible for some patients because they need appropriate medical equipment, and some of them mechanical ventilated is necessary. Also, in the shelter are crowd and a risk of infection for these children. Family of these children are terrified. Some children have an exacerbation of this injuries through explosion. Some children have different infections. Some children have dehydratations, as some of them must go to the shelter during the treatment at hospital. Families with palliative children from another region of Ukraine, where the situation was dangerous, where the Russian army has been attacking civilians, their houses and architecture building, are running to our region. A lot of people without electricity, without food, without water, a lot of families of palliative patients began to ask about different way evacuating them. From the beginning of the war, our hospital has been a clinical hub for these patients and their families. We were willing to hospitalize this patient to our hospital around the clock. More families with palliative patients from different regions of Ukraine came to our hospital. They were hospitalized, and after stabilization their state, they transferred abroad by forming convoy through green corridors, and also a lot of families decide to stay in Lviv because it's safer. A lot of our patients was evacuated to Poland, to hospitals Little Prince in Lublin. In this picture we can see the head of this hospital and our nurse who helped evacuated for us these patients. And also I want to tell some story about from these evacuated convoys. Evacuated convoys was very scary. These families were shocked. They cried and they asked for help for their children. Some of them told, we don't have a house. Our city is destroyed. We don't know where we will live in the future. One mother showed us the child's skin. She wrote the first and last name on the child's body. When they were coming to our hospital, the Russian army were shooting their car, and the explanation is if they died and the child will alive, maybe some relatives find this baby. Another story, when I come to the ward, the grandmother cried. She said, I'm crying because the child can sleep. They arrived from other city where was constantly explosion and air alarms, and this A child all time had convulsions, and this was the first time without convulsions in a long time. And another story, the boy who needed to remove mucus from the tracheostomy several times per day was without this procedure for 2 weeks. He was in a heart condition when they arrived. Saturation was 80%. And suddenly he stopped breathing and his head stopped beating. It was the clinical death. We began to resuscitate him in the ward. In the same time, mothers started to unpack their luggage in the ward, and since she had a traumatic experience before as a result of what she saw before. And this is our palliative patient before the war. And this is, on the slide, we can see our palliative care team. And also, in summarize, I want to tell you I'm really appreciate for your support, because when we are together, we have a great powerful, and also I believe Ukrainian will be win this aggressor, because evil cannot win. And thank you for invite us in this conference, and thank you for speaking about the situation in our country, because it's very important for us. Thank you so much.
Wow. Thank you, Vita. And I think if we look at our own lives, many of our big problems become suddenly very small. And I cannot even start to imagine what the life is like when you're taking care of children and there are rockets in the air. You have to go to bomb. People are injured and killed. So thank you for what you're doing. And in the best palliative care language, we're very sorry. The rest of the world is so sorry. And we feel hopeless. And this session is about to see how can we gather our strength together and help you and your families and in Ukraine. With that, another group who has stood up over the last few weeks and months is the group of psychosocial spiritual support worldwide. So I'm asking Richard Bauer to come up and tell us a little bit about serving Ukraine Global, so the psychosocial palliative care and counseling coalition. Thank you, Richard.
Thank you. I just have a few slides. Thank you. Oh, great, they came up. My name is Rick Bauer. I'm a board-certified chaplain at the George Washington University Institute for Spirituality and Health, and I also do clinical services at Children's National Hospital, also in Washington, D.C. And in my night job, I'm also on the executive committee for PalChase, and that's how we got involved with asking that question, what can we do? What can we do? Especially those of us involved with psychosocial support and spiritual support. So we started a small coalition, and I have the honor just to talk about a little bit about the work. I remember at one of the very first meetings, Justin Baker said to us, it's not what we want to do, it's what you need in Ukraine. And Maria, with the Soul Center, who provides some psychosocial support, is really at the head. What do you need? In terms of psychosocial support, and also in terms of spiritual, existential support, because we're not just confronting the anxiety and the depression of war. As you said, and I tear up, we are confronting evil. And that goes beyond the depression and the anxiety. It's at that deepest part of who we are as people and connected to confront such enormous and pure evil, to kill children in children's hospitals. And so we wanted to do both. And Maria and all of her staff in Kyiv kept saying to us, don't forget us. And so that's what we are trying to do, is have a global partnership with the Elizabeth Kubler-Ross Foundation, with Pal Chase, with G-Wish. How can, from the US, from UK, India, Singapore, New Zealand is also there, and a lot of help from the World Hospice and Palliative Social Workers that we're using trauma-informed psychosocial support and trauma-informed spiritual support, listening to what our colleagues need and providing that support with our colleagues. We've done a lot of things, and I know this is a busy slide, but it's, again, listening. It's providing that grief support to our colleagues, especially in Kyiv, listening to what trainings they want. We want to be able to, Elizabeth Kubler-Ross Foundation is going to do some grief support for the center in Kyiv, and hopefully for any other centers that need that. The George Washington Institute on Spirituality and Health is going to offer our ISPEC, our Interprofessional Spiritual Care Education Program for clinicians, free for anyone in Ukraine. We'll work to get scholarships if you and your staff would like that. So that we want to continue to be in solidarity with our colleagues. We've had some different initiatives, as Joan said. One of them is just to wrap yourself, with a bracelet to remember Ukraine, or with the scarf. And when we gather on these Zoom calls with our Ukrainian colleagues, that we are with you. We talked about having a moment of silence every Wednesday at 9 a.m. for our colleagues in Ukraine. And then finally, again, with Stacy Remke, who has been so helpful for us, especially with trauma-informed psychosocial support, to offer this training for the health workers in Kyiv and also anywhere else that we can be a support, and to remember that this is both psychosocial and that deepest part of how do we provide that spiritual, existential support when we are confronting just pure evil. And another little picture of how we're supporting each other. And again, as Joan mentioned, through social media, we have this soul buddy community that we're constantly WhatsApping each other, allowing our colleagues one-on-one support, uniting them with a clinician that's outside of Ukraine to provide that support, as well as some group support, and using art, as well as the best of spiritual and psychosocial support with our colleagues, listening to what they need, not trying not to put our agenda on Ukraine.
Grazie.